The uniform, which you've got a picture of, it was a blue and white striped pinafore. The hospital laundry would starch the apron and the bib, and then we had to attach the bib and the apron together on the inside with safety pins. And our pinafores were so heavily starched that when we would get them back from the hospital laundry, we would stand them up in the corner.
A good union is worried about social issues. They worry about people.
RNs looked for ways to use their newly won power to improve patient care.
We had to somehow have some type of a staffing system where we could safely ensure patients would get the care they needed. And so the first place that we fought that battle was in your critical care units.
CNA proposed legislation requiring that there be at least one RN to take care of every 2 critically ill patients.
It was a major battle. We had to fight the bureaucrats. We had to fight the hospitals. We had to fight the politicians. Everybody said it couldn't happen.
The odds were against them, but CNA prevailed. Their critical care ratios were the first in the nation, but the staffing battle would continue for the next quarter century. By the 1980s, greed was good in America, and hospitals had become big business. The corporatization of healthcare had dramatically escalated.
When Good Samaritan was bought out by a corporation, that's when we started to see tremendous changes. They had massive layoffs. Nurses were given more patients to care for. If you had some issues about some of the nursing care and you came to them and expressed those concerns, they would say to you, if you don't like it, you can always go elsewhere.
To cut costs and maximize profits, the healthcare industry restructured its workforce. Hospitals hired less trained workers to take over duties previously done by RNs.
At my hospital, management decided unilaterally to lay off 20% of all the registered nurses and replace them and other skilled hospital healthcare workers at the same time with lower paid what we called unlicensed assistive personnel. And that was a huge change in our working conditions. The move to remove nurses from the bedside would not only just change the nature of the profession for me, but it would make it much more detrimental to our patients.
In the hospital, there was no longer that supportive structure for the patient and the nurse. They removed that so that they could have their bottom line. So CNA as an organization had to step in and fill that void.
But CNA was having problems of its own. The staff RNs, now 90% of CNA's members, were strongly opposed to restructuring, while CNA's board of directors supported it.
The board was basically comprised of educators, managers, people that really weren't the ones that were at the bedside giving the care to the patients. And they really didn't know or understand what the needs were of the nurses and really of the patients.
The conflict between direct care nurses and the board reached a breaking point during the summit strike. All hospital workers walked out for the right to support each other.
We actually were attempting to work together with all the other labor unions in healthcare and raise the standard for all healthcare workers. And I think that was threatening to them because they always thought that we were somehow better than, separate than, different interests than other healthcare workers.
The last straw, I think, was when they fired our staff just before Christmas.
They fired a lot of staff who they thought were actually in control of this movement, but really it was the nurses. And the nurses essentially rose up and said, no, that's not okay. We were going to get our staff back. So we ran a slate of officers for the board of directors.
We won the election. We booted out the old board. They couldn't believe that we had done it. They could not believe it. We were ecstatic, And we were also scared, very scared. What have we done, This big organization, what does poor little staff nurses know about running something?
Because nurses' area of expertise is patient care, and that's what we do all the time. We know all about that, and we're very good at advocating for our patients. But many of us do not have a labor background, and there's labor staff. We've hired some really fantastic staff who come out of the labor movement. Roseanne DeMoro is one of those.
You had the nurses as patient advocates with the power and the finances at this point in time. Now they control the organization. They can use all of the resources to fight for their patients and fight for themselves for the first time in history. You had the staff who had phenomenal skills and backgrounds, and coming together with the registered nurses, putting together strategies, tactics, passion, politics, all of it coming together. And I can tell you, from our perspective, it was the perfect fit. From the healthcare industry, it was the perfect storm. It was the seminal moment in history, I think, for registered nurses associations across the country, because the registered nurses rose up. They said no more. We are taking control.
When we took over, it was a battle about how patients were viewed and how health care was delivered.
With frontline nurses in charge, CNA focused on patient advocacy. The Patient Watch program helped those who were harmed by unsafe medical practices. CNA co-chaired a state initiative that would have established a single-payer health care system. Then, in 1995, CNA shocked the nursing world by cutting its ties with the American Nurses Association.
It did make a huge splash in nursing because ANA purports to speak for nursing nationally in America, and it doesn't actually.
We realized that we were handicapped by belonging to ANA because they were going along with the industrialization of healthcare.
So it seems silly that we went to all the trouble to take over CNA, to change the direction of protecting our jobs and protecting our practice and patient care, and then send, at the time, $1.5 million a year to this organization that then was trying still to remove us from the bedside.
That was a very powerful time because that enabled us to have the funds to go on and organize CNA as we wished it to be organized.
Now totally independent, CNA set out to establish a new identity.
I would say the biggest change is that we said we would focus on the members' concerns. Those members are going to come to the forefront. They're going to set the direction of CNA. They're going to set the direction for their professional practice. They're going to set the direction in the kinds of legislative battles we had in Sacramento.
The RNs of CNA turned out one patient-oriented reform after another. They joined forces with consumers for HMO reform and a patient's Bill of Rights. They sponsored laws strengthening the RN's role in patient care and giving workers who expose unsafe conditions in hospitals whistleblower protection.
There is nothing that we do that does not have something to do with patient care. Ratios, whistleblower bill, it's so that we can deliver better care. We fully believe that it's going to be the nurses, the RNs, who will lead the change in health care.
In their mission to put patients first, CNA nurses faced a monumental battle with the biggest HMO in the country.
We as Kaiser nurses always was the first one to negotiate our contract, and then all of the hospitals will follow afterwards. So we really needed to fight not only for the Kaiser nurses, but for all of the RNs in California and even the United States.